So yes, I will just go on because of time. So what is stroke? Stroke occurs when there is an interruption to the flow of blood to the brain, and so there begins to happen some changes in the body at that time, which is why we're going to talk about it today. Thank God it's there, so you all can follow with me. And when there is that interruption, a lot of stuff happens in the body. So we'll be emphasizing on that because key note is understanding and what you should do. But back again, stroke occurs, I said, as a result of damage to the brain from interruption of its blood supply. What are the types of stroke? An ischemic stroke occurs when blood supply to the brain is interrupted, reduced, and of course we know that the brain handles a lot of stuff in the body. So once the blood doesn't get there, the blood cells, they begin to die off, and quick intervention is very necessary to know what you should do and when you should do it. A stroke is a medical emergency, like I've said, and prompt treatment is crucial. Early action can reduce brain damage and other complications. Now, I said there are three main types of stroke. I mentioned one, the ischemic stroke, which of course is what I just talked about, causes a blood clot, and it causes the flow of blood to the brain. And then there's problem with heart valves, injury to the blood vessels in the neck, and blood clotting problems. That is what ischemic stroke causes. The second one is the hemorrhagic stroke, and that is when there's bleeding in the brain and it causes damages to the nerve cells. And the causes of hemorrhagic stroke sometimes is due to age. 65 years and above are high risk, you understand, and high cholesterol, being obese, family history, or if you've had a stroke before. When I said if you've had a stroke before, we have, I will go to that, that's on the third one. And of course, smoking. Why did I say smoking? I'll just touch on that. You know, mainly I talked about a blockage to the brain. So smoking causes plaques to build up. When it builds up, it won't allow blood to flow. And of course, if it narrows in the valve, there is no blood flow, it causes stroke. And same with eating unhealthy food that have high cholesterol, it builds up all the fat, affects the flow of blood. The key thing to understand is that when there is no flow of blood, stroke is going to happen. So it's just like no flow of blood to the brain, stroke will eventually happen. So trying to maintain a constant flow of blood to the brain would prevent the occurrence of stroke. Trans-ischemic stroke was what I was trying to talk about when I said if you have a history of stroke. Trans-ischemic stroke is like what would call a mini stroke. So you have all the symptoms of stroke, it looks like you're having a stroke, but after 5 minutes, everything resolves, and you're like, it looks like I was feeling some sort of weakness, it looked like something is wrong, but it only happened for few minutes and everything is back to normal. You should still get to your doctor. You shouldn't just take it like, oh, what is happening? Because it might happen again, and at that time, it might be the full stroke, and it might not, it might be a partial stroke or a full paralysis. Now, what are the, I'm trying to be very fast because of the time. What are the symptoms and what should you look for? Like I said, early intervention is very key. I believe you all must have heard about the acronym FAST. But now I'm adding to it, I called it Be Fast. Now the National Stroke Association and the National American Health Association have that FAST acronym. And so what does FAST mean? But I added Be Fast because while I was just searching, I realized, like I said, that there are some other stuff that we need to understand. First is balance. If the person, say you're in the house with someone and you begin to notice that they're having issues with their balance, like there's that instability, they can't walk, they're falling down. The eyes, they are saying, oh, it looks like I can't see well. They're having blurry visions. It might be full, not seeing. I can't see anything. Now, please pay attention to how I'm going through it, and which is why it's also on the screen, because I tend to speak very fast. So the third one is the face. Facial drooping, So when you see that it looks like this person's face is, somehow you ask them to smile. Mommy, smile. Yes, when someone smiles, you want to see that their cheeks, there's that full smile. But when they smile and you see that it looks like one side of the face is not drooping compared to the other one, you want to take note of that. Then the hand, you ask them to raise the hand. And just like I'm doing this, you all should be able to do this. But if you're asking them to do that and they can't lift the hand, then then that's also something to take note of. And the speech. Ask them to talk or repeat a sentence. How are you doing? Ask them to repeat it. And they can or they're trying to say it and it's slurred, like how. You just need to know. The last one, which is very important after noticing all of this, is time. Right the time you begin to notice all the symptoms, because they're going to ask you when you get to the hospital, and immediately call 911. There are two things: time and call 911. After doing all this fast stuff, and you see that, okay, it happened at 9:45 a.m. p.m., note the time. Because like I said, early intervention, when they get to the hospital, they're going to ask you, because there are a lot of other treatment that they would want to do, but they want to be sure when it started, because they can't do that after a certain hour. So the next thing will be the next slide. So what are the treatments? I said blood thinners, medications, supportive care, cardiac monitoring. Cardiac monitoring is, I believe that other presenters have come here since we've been starting this health talk. Know what your blood pressure is. This should be a standard for every adult. You're above 18, know what your normal blood pressure is, because then you would know if your blood pressure is getting high, because atrial fibrillation, know what your health history is. Atrial fibrillation can also lead to stroke. When the heart is supposed to be pumping and it's having irregular beating or pumping, like I said, it's going to affect the flow of blood to the brain. And what did I say happens? When there is flow of blood, what happens? Stroke is inevitable. So once we understand all of that, but what happens when stroke occurs? Like I said, it might be partial, it might be a full stroke. The treatments, we have the supportive care, and there's also surgery. Surgery, sometimes, it's also based on the time. Like I said, most time when they want to give a particular medication in the hospital, they want to know what time. And sometimes if they see that, okay, there is the plaque building up in the carotid artery, okay, let's try to take it out, which is where I talked about the surgery, the carotid endarterectomy, to take off the plaque, so that, like I said, if the plaque is building up there, it's just like I made a hole sign. If the plaque keeps building up, it keeps building up, it keeps building up, it narrows this letter hole and it becomes this. You see what I'm showing? So with that, a surgery can be done to take out the plaque so that there will be free flow of blood. And of course, when it's happened. There are therapies, speech therapy, physical therapy, rehabilitation, and all of that. So the last slide should be, okay, questions. Now, that's why I said it's a very short presentation, because I understand that I have limited time. But if you take nothing from this presentation, understand time and the signs to watch out for. Understand the risk factors. Let's stay healthy. Let's watch what we eat. Let's understand our family history. See, if you have a family history, your parents have issues, they have cardiac health issues, you need to watch what you eat, because eventually it's going to happen to you, not their health history, but you're part of them. But when you understand that your parents are diabetic, your parents have congestive heart failure, you have to understand that you want to be very, very mindful of your health, exercise, eat healthy, check your blood pressure, because when it creeps on, the blood pressure will let you know that, okay, this is abnormal, and then you'll be able to make your appointment with your physician to let them know that, okay, I did my blood pressure today and it's just abnormally high, and then that is early intervention. But let's say you're not doing all of that. You don't know, maybe it's been, and they I just feel headache here and there, I'm just tired. It doesn't just happen. Our body tells us. So this year, 2023, I'm admonishing all of us, myself inclusive, to pay attention to our health, to understand that whatever happens in our body doesn't just happen. It's a result of activities that we are doing, we have done, that made that possible. Do we have anyone with any question? And that ends my presentation.